it's not because men are weak. It's because this disease becomes simply exhausting. Think about the emotional load, the fear of retention, the fear of leakage, the fear of the smell, the fear of sex, the fear of travel, the fear of infection, the fear of needing help, the fear of losing independence, the fear that the bladder will never recover, that you will never pee again normally. Welcome to BPH 360, where bladder health matters. I'm Dr. Wayne Kwong, Cleveland Clinic trained urologist. BPH is not just prostate enlargement. It's about protecting your bladder. Learn to ask better questions, take control. For education only, not medical advice. For your care, consult your doctor. Welcome back to part 2 of this episode. If you missed part 1, go ahead and check that out first, where we talk about lifespan, health span, as well as bladder span. In this part, let's dive into sex span and the impact of BPH on your mental health. In the first part of this episode, we talked about lifespan, the number of years lived. We talked about health span, the number of years lived in good health, and how the goal is to match your health span to your lifespan as best as possible. And then specifically to men who are challenged by BPH, how do we optimize or maximize a man's bladder span, the number of years lived with optimal bladder function? This is such a critical part of how a man can live the best years of his life incontinence-free and catheter-free. This concept of bladder health, preserving bladder health, as well as preventing late-stage disease is such an important conversation that I was very grateful that we had the opportunity to publish these thoughts in the June issue of this peer-reviewed academic journal, the Journal of Urology. So now that we can start having a dialogue, not just only with you, but also with our colleagues, primary care doctors, advanced practice providers, other urologists, academics, and we can start having this dialogue about how do we bring the bladder into the spotlight for men who are faced with BPH or prostatic bladder obstruction. Bladder health is a topic that too many men do not want to talk about. In previous episodes, we talked about that cowboy avatar, that cowboy archetype that's going to grit through, push through the symptoms because we're tough. But that's not the way to look at this. This is about protecting your future, not just about how well you can manage and push through your symptoms of urgency, frequency, getting up in the middle of the night, or even leaking. Too many men are laughing it off about having to get up multiple times at night. And too many men are saying, it's just part of getting older. It's just the aging process. But in truth, not many men are laughing when it's late at night and they're having to hide in the shadows because they're not going out anymore, or they're not able to take that trip to see their grandkids, or they're getting embarrassed about leaking and staining their pants with urine. It's no longer a laughing matter when men are feeling less masculine, when men are avoiding sex because their partner could possibly reject them. It's no longer a joke if men are having to avoid trips because they don't want to explain all the stops at all the gas stations just to use a bathroom. There is nothing comedic about men who have to avoid long meetings, or always having to buy aisle seats on the airplane, or avoiding going out to play golf with friends, or going to church, or long road trips. For too many men, the challenge of BPH is beginning to really shrink their world. This is one of the most dangerous parts of progressive bladder disease from BPH. It can slowly make a man's life, your life, smaller and smaller. And it's not overnight. It's not dramatically, but it happens little by little. One avoided event at a time, one missed trip, one awkward night, one embarrassing leak, one catheter conversation, one more reason to just stay home. A struggling bladder can shrink a man's life and world before anyone else notices. If you remember from my very first episode, I talked about the inspiration for this whole Man vs. Prostate campaign was one of my very first patients, a cowboy from southwestern New Mexico who had been struggling with his symptoms for decades. And for far too long, he had fell victim to the polypharmacy epidemic, where, hey, Mr. Smith, you got a problem, take a drug, or you still got a problem, take a second drug, or you still have a problem, take a higher dose, before anyone said, hey, your symptoms are severe enough, it's impacting your life in such a significant way, let's get some data. Let's do some diagnostics. And if they had only done that earlier on, 10, 15 years before when I met him, we could have found out that his prostate was growing to a size that was beginning to make his bladder struggle, which was negatively impacting his life. And if we had only been there earlier on in his journey, then we could have intervened at the right time for him earlier within that window of curability before the damage to his bladder was permanent. Sadly, when I met him, his disease had progressed to the point where he only had two options at that time in 2006. It was either to continue living his miserable life with all of his symptoms of urgency, frequency, getting up at night and leaking on his leg, or a major surgery. And at that time, faced with those two choices, he chose the path that he could control most, and he chose to end his life. He reminds us that we can be better, we can do better together. Let us start sharing the word that for men facing BPH or prostatic bladder obstruction, this is about your bladder health, and preserving your life so you can live the best version of it, incontinence-free and catheter-free. Too many men are not listening to their bodies. If you're having those symptoms of urgency, frequency, slow flow, remember those symptoms are your bladders talking to you and telling you that your bladders are not doing okay, that they're struggling and they need help. Too many men are putting on that cowboy archetype. Too many men are waiting until it's too late. Too many men are having to reach a certain tipping point before they will ask for help. And for many men, it may be you, it's often waiting until it's a crisis, often until stage 4 or stage 5, where the bladder is no longer functioning well, where you're showing up in the emergency room because you can no longer pass your urine, and now you need a catheter to drain the urine out of your bladder, or heaven forbid, in stage 5, your bladder's beginning to die. As you can see on this article, this researcher and their team in 2022 did a great job of starting to interview men who are faced with these challenges of BPH, prostatic bladder obstruction, in characterizing this tipping point or the mentality of them waiting until it gets to the point that often it's too late. So it's called reaching a tipping point. Let's take a look at one of the quotes from one of the men. Quote, "I don't think it's probably as bad as what other people have actually had. My father had something similar. I remember it got to the point where he had to have a catheter put in to deal with it. What I'm going through is nothing compared to what he had at all." As you can see there, he's totally minimizing his symptoms. He's normalizing it. He's putting on that armor of masculinity and going, hey, my symptoms aren't that bad. I'm going to wait until I enter into a crisis situation like my dad, where he entered into stage 4. The mindset is to delay. But you all know that, please, if you're having symptoms of stage 2 and stage 3, those are warning signs for you to get your data, to pursue diagnostics, if that's a good decision between you and your provider, so that the data can help guide your decision-making about how to best manage not just the prostate tightening up, but also your bladder. Now it's important that we switch gears to a very sensitive topic, and it is coined by a term by one of my colleagues, Dr. Mohit Khera, sex span. That's the number of years lived with optimal sexual vitality. Sex span does not mean every man has the same sex life forever, but it does mean preserving the possibility of intimacy, confidence, desire, and dignity for as long as possible. And this is where late-stage bladder disease from prostatic bladder obstruction, BPH, can become brutal. Not just erections, not just ejaculation, but confidence, spontaneity, comfort, body image, dignity. It is sad when some of my patients are detailing to me how it's hard sometimes to have sex. So, for example, this one man who's in stage 3 urgency incontinence, he can't tell when he's getting intimate with a woman whether he's about to try and ejaculate or whether he's actually about to leak down his leg. That is so embarrassing and emasculating and deflating and depressing for him. And what about those guys who are using catheters, and some guys have to worry about the tubing or leg bag? How are they going to be intimate? And for some men, they've had a small procedure where they have a tube placed into the bladder through the abdomen, which is a very bad location if you're trying to have sex. At this point, sex is not just about performance. It is about whether the man feels even confident in his own body. Let's take a look at some of the research that's out there. This is a very famous study over here in 2003 by Rosen et al. Out of Europe in the United States, looking at almost 13,000 men who are suffering from their BPH. And what you can see here is that as men age, as their symptoms of urination worsen, they are having less sex, having worse erections, and more ejaculatory dysfunction than a classic 2011 Epaulette study. This group, led by Dr. Coyne, looked at men out of the UK, Sweden, and the US, and what they found in this questionnaire of over 6,000 men, when you look through the lens of the 5 stages of bladder health, and specifically at the first 3 stages, what you find is eye-opening. As men progress from the earliest stages to stage 2 and into stage 3, we see that they start having ejaculatory dysfunction that goes from 18% all the way up to 50%, 1 in 2 men. And then when we look at erections, we see that once again, as they progress into stage 2, overactive bladder, stage 3, the rebellious child, urgency incontinence, we see that only 1 in 2 men are having sex. We can also see that by stage 3 urgency incontinence, now we're seeing that 1 in 3 men are suffering from erectile dysfunction. Additionally, 28% of men no longer enjoy sex as much. That's for stages 2 and 3, but what about stages 4 and 5? When you hit that crisis point, the tipping point, where you're having to show up in the emergency room, needing a catheter to drain your bladder because you've gone into retention, or even stage 5, where you're having bladder failure and having to face the concept of a lifetime of catheters. There's no way that sex is going to be easy. In 2014, these researchers right here, they interviewed a lot of men who were in these late stages of disease requiring catheters. And yes, it is not easy to be intimate, to feel sexual, to feel sexually alive when you have to deal with a bladder that's struggling or failing and having to use those catheters. Moreover, in 2024, the European Association of Urology Nurses Guidelines then came out with a recommendation that if you are having to live with a catheter, one workaround is to actually take a condom, pull your catheter back over your penis, as you can see here, and then put a condom over both to have sex. That's just not okay. It looks exceedingly uncomfortable. We have to do better. We have to take the time to be proactive and prevent men from needlessly entering into these later stages of disease, so that no man has to face this situation where they have to consider putting a condom over both their catheter and their penis in order to enjoy sex once again. Obviously, who is thinking about romance when you're scared about leaking? Who is thinking about sex when you're having to wear a leg bag? Who is thinking about intimacy if you're worried about tripping over your tubing? This is not vanity. This is not weakness. This is human existence. This is suffering. Bladder failure does not stay in the bathroom. It follows men into the bedroom. Quick pause. This is a serious moment. If your urine flow is very slow, or you're having worsening urgency, leakage, or retention, that can be late-stage disease. At that point, supplements and pills may not be enough. On manvsprostate.com, there are simple tools to help you see where you may be on the bladder health stages and whether it's time not to wait and to go see your doctor and to ask, what about my bladder? Learn more at manvsprostate.com. Back to the episode. Switching gears, let's start to talk about the impact of BPH, prostatic bladder obstruction, on mental health. As men move from stage 1 to stage 5, the burden on your mind and spirit becomes increasingly worse. It's not because men are weak. It's because this disease becomes simply exhausting. Think about the emotional load, the fear of retention, the fear of leakage, the fear of the smell, the fear of sex, the fear of travel, the fear of infection, the fear of needing help, the fear of losing independence, the fear that the bladder will never recover, that you will never pee again normally. That is simply a lot to carry for any man. The world of academic medicine is recognizing this correlation between the stages in the decline in mental health. Here's one article looking at the relationship between depression and the lower urinary tract symptoms secondary to benign prostatic hyperplasia, BPH, or as we talk about, prostatic bladder obstruction. And here's another article in 2009, The Burden of Lower Urinary Tract Symptoms, evaluating the effect of these symptoms on health-related quality of life, anxiety, and depression. And even more recently, here's a review in 2023 looking at the psychiatric disorders associated with these symptoms leading to depression. To be clear, more research is needed. We currently do not have enough evidence to prove causality, but we do have enough evidence to suggest that this is something that's real, that needs to be looked at in more depth with more research. But at the end of the day, it's something that you need to be thinking about in regards to your symptoms of BPH, because if your symptoms are causing you to feel down, to feel deflated, you need to talk to your provider to get your data. These authors clearly highlight that this is only the beginning of this conversation. Yes, there are data who suggest a link between depression and the symptoms of BPH, but we need to do more. More importantly, I need you to ask yourself, am I feeling deflated? Am I feeling anxious? Am I feeling depressed about the symptoms that I'm having with urination associated with BPH? If you are, I need you to step up and talk to your provider about whether or not to pursue diagnostics and get your data to find out what are the best management strategies for your prostate and your bladder. In this study, you can see here, whether it's for men or women, when we look at this type of data, when we look to the right of this vertical line, these are multiple studies. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 studies that are to the right of the line showing an association between depression and symptoms of BPH. Now, this is early data. Once again, more evidence-based research needs to occur. But please, if you're having these symptoms, please see your doctor. So yes, we should not overclaim, but we also should not ignore what you're having to live with. If you're getting up 4 times a night worried about leaking, avoiding intimacy, always having to worry where the next bathroom is, fearing a catheter, that is not just a urinary score. That is suffering, and you shouldn't have to suffer. You deserve to live the best version of your life. But let's get a little bit more granular. Across the world now, folks are starting to do some research specifically to address the link, this possible link between depression, anxiety, and the symptoms as you progress through the 5 stages of bladder health. Researchers are starting to use this new survey called the PHQ-9, which is a very brief, simple, 1-page survey to assess levels of depression. Let's go through it now, as I think it may be helpful. If you're answering yes to these questions or multiple questions, it's time to talk to your provider about your symptoms of BPH, prostatic bladder obstruction. As we see here, over the last 2 weeks, how often have you been bothered by any of the following problems? So once again, if you're saying yes to a couple or many of these, that means it's time to learn more about your symptoms and about your prostate. So number 1, little interest or pleasure in doing things. Number 2, feeling down, depressed, or hopeless. 3, trouble falling or staying asleep or sleeping too much. 4, feeling tired or having little energy. 5, poor appetite or overeating. 6, feeling bad about yourself or that you are a failure or have let yourself or your family down. 7, trouble concentrating on things such as reading the newspaper or watching television. 8, moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety or restless that you've been moving around a lot more than usual. and 9 thoughts that you would be better off dead or of hurting yourself in some way. The research question is simple. As men progress from stage 1 to stage 2, stage 3, the leakage, stage 4, retention, stage 5, bladder failure, does depression and its associated burden also rise? Our hypothesis is yes, it makes sense. How can you be in a better mood if you're having a catheter or having to put in a catheter several times a day? How can you be happier if you're starting to leak on yourself to the point that you avoid going out and you're embarrassed by the smell and leaking on your pants? And if that is true, then late-stage BPH, prostatic bladder obstruction, is not just a urinary disease. It's a mental health disease. It's a relationship disease. It's a family disease. It's an independence disease. Remember, if we are only measuring the urine, we may miss the suffering. To recap, yes, as we see here, lifespan is when we calculate the number of years lived from the time of birth on the far left to the time of death. Most men recognize it's not just about living longer, but it's also living better, maximizing the number of years lived with optimal health within your lifespan. And we call that your health span. And a critical part to that is going to be your bladder span, the number of years lived with good functioning bladders. As you see here, we can look at stages 2, the overactive bladder, and stage 3, urgency incontinence, the rebellious child. And you can see that they start to rise probably around 50s, where we can see that by 55 to 64, over 1 in 3 men are having stage 2 symptoms of urgency, frequency, getting up in the middle of the night, and 1 in 5 men are starting to have some evidence of urgency incontinence, some leakage. Then by the time they're reaching 85 or older, we can see that 70% of men are in stage 2 and 60% men are having evidence of stage 3 leakage. Then for stage 4 retention, we can see that as men starting entering into their 60s and 70s, approximately 1% of men per year will have an issue with going into stage 4 retention where they can't pass their urine at all and they're having to call 911 or go to the emergency room to have a catheter placed to drain that bladder. Most men are not going to die from BPH. There are some very rare exceptions, but for the large part, it's not going to be a cause of death. But late-stage bladder dysfunction, those later stages of the 5 stages of bladder health, can truly affect the way a man lives out the last chapters of his life. A simple example is just the nocturia, the number of times you're waking up to pass your urine. When it's 2 or more times, men are starting to feel the effects of poor sleep over years and decades. As a result, they have mental fog and they have this chronic fatigue that does not allow them to be the best version of themselves as husbands, as fathers, as co-workers, as brothers. And obviously the risk of infections or stressing out or injuring your kidneys adds to the seriousness of the burden of BPH, prostatic bladder obstruction. Yes, this disease process can prevent men from being the best version of themselves, living a fully independent, fulfilled life. So yes, it is so much more than just lifespan, the number of years lived. It's really about the number of years lived where a man is living to his fullest capacity with strength and confidence, autonomy, and freedom. To do so, we need to maximize health span. We need to optimize bladder span, the number of years lived with optimal bladder function. The question is not only how long you live, the question is how much bladder function, bladder freedom you get to keep while you live. As seen here by the Global Burden of Disease Database, Institute for Health Metrics and Evaluation in 2021, there is a global disease burden of which BPH is a significant part of it. Why are we so passionate about optimizing your bladder span, your bladder health? As we see here, if we look across the globe and we look at the burden of disease seen worldwide, we know that if we do nothing, the burden will just slowly increase across this earth. But we all can come together and we can work together to bend the disease burden curve. Through many other parts of healthcare, we can start reducing that burden by about 35%. If we start thinking about preventative measures, intervening earlier to prevent long-term disease and the burden associated with it. This is exactly what we're talking about today for all of you who are challenged by BPH, prostatic bladder obstruction. By simply being pre-educated, going in to talk to your urologist or primary care doctor with that one question, what about my bladder? That one question can help you get the data you need sooner to make better decisions earlier within that window of curability so that fewer men are having to enter needlessly into those later stages, stages 3, 4, and 5. As you can see now on this graph, they show that as men are getting older over time, our life expectancy is increasing. Men are living longer, but there's a discrepancy between the years lived and the years lived in good health. And you can see that by 2050, there's going to be a discrepancy of 11.4 years between the total years lived and the total years lived in good health. And one of those areas, like we talked about, is optimizing your bladder health, your bladder span, so that this number can be decreased, and so our health span more closely matches your lifespan. One final note. BPH is not just a disease that affects just the man. It also affects his partner, your partner. Partners also live through this as well. They may notice the sleep disruption, the irritability, the avoidance, the minimization, the embarrassment, the canceled trips, the lack of intimacy, the fear, the silence. Sometimes the partner will see the decline way before the man will. This is why, as you are tackling your BPH, remember this is a team sport. You're teaming up with your partner in addition to your providers, your urologist, your loved ones, your partner, parents, sisters, brothers, children. They can be a great sounding board, a mirror to show you how much your symptoms of urination from BPH are negatively impacting your life. Please listen to them, listen to their advice, listen to their observations. When your symptoms are beginning to affect you in a negative way, when you're entering into stages 2 and 3, those are warning signs to get more data, or at least have a dialogue with your doc. Remember, BPH may start in one man's body, but late-stage bladder dysfunction can actually enter the whole household. Kind of a funny story is I was taking care of a man and we were able to navigate him, intervene soon enough within the window of curability. He needed a deobstruction for his prostatic bladder obstruction. And as he was recovering and he was getting up fewer times at night, the wife actually stopped me and said, "Hey, I just want to say thank you, not just for me. It's been great for us all to be getting more sleep, but also for our dog." You see, the dog slept right at the foot of the bed, and every time her husband would get up to use the bathroom 3, 4, 5 times a night, he would wake the dog up, and now the dog was even sleeping better, and so she wanted to thank me on behalf of the dog. Funny story. So yes, do not wait until the bladder is failing to ask about bladder health. Do not wait until there's a catheter. Do not wait until there's leakage, and do not wait until that becomes your new normal, or having to get up 5 times a night becomes your new normal. Do not wait until sex, travel, your mood, confidence are being damaged. Ask your doctor, what stage is my bladder health? Ask your doctor, do I have signs that my bladder is compensating, struggling, or even failing? Ask your doctor, do I need a bladder health baseline? Remember that one question that should be part of any and all visits that you're having about BPH. What about my bladder? The goal here is not to scare you or to scare men. The goal is to make you all wake up earlier before it's too late. The best time to protect your bladder span is before the bladder becomes an emergency. BPH is not just a prostate story. It is a bladder story. And if the bladder declines far enough, it can affect sex span, health span, bladder span, mental health, independence, relationships, and your dignity. So if you or someone you love is dealing with worsening urinary symptoms, do not reduce the problem to simply, he's just getting older. Please get evaluated, ask better questions, protect your bladder while there is still time, because bladder health matters. Thanks for watching. If bladder health matters to you, watch more. Follow BPH 360 to stay ahead of your symptoms. Listen on Spotify and Apple Podcasts.